As COVID-19 pandemic poses serious threats to public health globally, Nigeria faces a potential public health crisis due to the COVID-19 and other infectious diseases such as Lassa fever. Well, recently, the NCDC announced that more than 30 people have died of Lassa fever since the beginning of the new year, with 170 cases in 3 weeks. Amidst this public health concern are health workers who are in the front line of the fight and who also get infected and sometimes lose their lives to the disease. Well, Dr. Akiala Ishako, a virologist, joins us for more on what this trend means under the current coronavirus pandemic. Thank you for joining us on the program.
Thank you, Melissa, for having me. Good evening, Nigerians.
Good evening. Lassa fever and COVID-19, what are the similarities, the differences, and is it time we shifted focus to tackling Lassa fever?
Lassa fever and COVID, all of them are viruses. They belong to the class of the virus we call the RNA virus. So we have two types of viruses based on their genetic makeup. We have the RNA and the DNA virus. So both Lassa fever and COVID-19 fall within the category of the RNA virus. The difference is that one is a viral hemorrhagic fever, the other one is respiratory syncytial virus. Their mode of transmission differs. One, it is Lassa fever, it is basically through foodborne. When rodents like rats infect food products, and then, they are transmissible to humans through contamination of food materials. COVID-19 is basically airborne. But one of the unique things about the two viruses is that they present clinical signs and symptoms of cough or fever, sometimes difficult in respiratory, difficulty. So basically, these are the similarities and differences. You asked a very valid question whether we should have a paradigm shift to focus on Lassa fever. I want to say that there is no need to have a paradigm shift to focus on Lassa fever. It will be good for us to have a holistic, integrated approach in handling most of these epidemics. Melissa said we are having an epidemic in a pandemic with a very weak healthcare system. Our hospitals are being overstretched. What we just need to do is to see how we can support our surveillance system. Melissa said even in the outbreak of Lassa fever, if journalists even report Lassa fever more than even before medical personnel should be able to dictate it. One unique thing about Lassa fever in Nigeria, it is that it is seasonal, it is cyclic in nature. So it gives us an ample opportunity if we're able to understand the dynamics and the seasonal variation in terms of transmission for us to handle it. So I think instead of having a paradigm shift to focus on Lassa fever, we also have other infectious diseases such as the meningitis, such as cholera, and all what have you. All what we need is a robust, integrated approach in surveillance.
We also understand a report by the National Library of Medicine saying that, coexisting with COVID-19 and its impacts, cases of Lassa fever, especially in West Africa, have been underreported. And one of the reasons they gave was, hesitancy in visiting clinics, contributing to the silent outbreak. But sadly, we've also lost some frontline workers to Lassa fever. What do you think is responsible for this trend?
What is responsible for this trend is basically a lack of environmental sanitation. In where we come from, our environments are so dirty, and that's where most of these rodents that transmit this Lassa fever, this Lassa virus, cohabit with human population. You are right that we have issues of nosocomial infection among healthcare workers. This year, we lost 2 doctors from my state because of Lassa fever. So what is also responsible for this trend is that even within hospital environment, we don't take precautions when it comes to infection prevention and control. That is the IPC component. So having a paradigm shift from our lack of proper environmental hygiene to the understanding of how infectious diseases transmit even within hospital environment is also key for healthcare workers. We also need to actually do a robust capacity training. Not all health workers can be able to pin down the clinical signs and symptoms for Lassa fever. And so sometimes you assume that you are treating malaria, you assume that you are treating some typhoid fever, not knowing that you are also handling a Lassa fever case. So healthcare workers need to have a high suspicious index when it comes to handling of cases, generally when it comes to presentations of by clients. So the trend continues because of lack of proper understanding of the disease dynamics and because our environment are so dirty and then we don't keep our environment clean. And then also the even the reporting, like I said earlier, journalists even report Lassa fever more than even medical personnel. So we must have a robust system of how we can be able to pin down cases and begin to report them accordingly.
All right, shifting focus to all of the pandemics and epidemics as well. We appreciate your time always on the program. Dr. Kiela Ishaku, a virologist, joining us from Abuja studio. Thank you.
Thank you for having me.